Hi everyone, my name is Bethany Eby, and I'll be explaining the teaching method of Socratic questioning. What is Socratic questioning? It was created by the well-known Greek philosopher Socrates to help his students learn in a different way. Socrates wanted to learn to self-teach, but still be guided in what they were learning. The goal was for the learner to develop the fullest possible knowledge about a topic, which is then completed by the learner basically teaching the educator. The educator professes ignorance of the topic in order to engage in dialogue with the learner. With the educator basically acting dumb, the learner feels as though they know and understand something and find meaning in discussing the topic. The learner is able to correlate known information with new information without much prompting, and it helps the learner store and recall the information later. The educator uses purposeful questions that are formulated to inspect the learner's interpretation and/or reflection of situations, values, and beliefs that then help to deepen the understanding of the specific topic. An important aspect with Socratic questioning is that the educator is to use the questions as a way to guide the conversation instead of just directing it. When education is given via an educator reading from a handout or talking for the majority of the conversation is directed by the educator instead of guided. The questions then help the learner self-learn by keeping them from becoming sidetracked and point them in the most helpful direction. In order for the self-learning to work the best, the learner should be talking for the majority of the conversation. As the learner talks, their mind is working to create correlations to concepts they're already familiar with. Instead of just new knowledge, it becomes something that is built upon prior knowledge, and it is proven to be recalled better in the future. In having the learner talk for the majority of the conversation, active listening is a key tool that needs to be utilized by the educator. It is very important for the educator to understand the tool of active listening and utilize it well so that they can guide the conversation in the correct direction. If the educator is unfamiliar with active listening, they should research and work on the skill prior to using this teaching method. There are several types of questions that can be used with the Socratic teaching method. First, clarification, and using questions like, "What do you mean by?" can be used to help guide the conversation and help the learner dig a little deeper. Second, the question can be about the initial question or issue that started the conversation. A question such as, "Why do you feel this question or issue is important?" Third, assumption using questions like, "Do I understand you correctly when you say?" This helps the educator from making assumptions and helps guide the conversation in the right direction for the learner. Fourth, the question can be based on the reason behind or evidence towards something the learner said in the conversation earlier, such as, "How did you come to that conclusion?" Fifth, questions relating to the origin or source of what was said previously. A question such as, "What caused you to feel this way?" And sixth, questions relating to the implication and/or consequence of a discussed potential decision or action. Questions such as, "What effect would this decision have?" And seventh, questions relating to the viewpoint of others outside of the conversation. A question such as, "What might someone who believes blank think?" As you can see, all of these types of questions continue the conversation and guides the learner to a conclusion. Using pointed questions instead of a simple yes or no answer questions, or simply giving a run-through of education, help greatly in providing effective education. This may sound very familiar to something we learned in this nursing course. Motivational interviewing is based off the Socratic questioning teaching method, but it focuses specifically on motivating the learner towards a behavioral change. The three principles of the questions in motivational interviewing, collaboration instead of confrontation, evocation instead of just education, and autonomy instead of authority, fit perfectly into Socratic questions that we discussed earlier. An acronym that is utilized by Susan Bastrobal work well when describing Socratic questioning. READS is one of them. When continuing the conversation with a learner, it is important to roll with resistance. With the pointed questions, the learner may find it difficult or frustrating to find the answer and may become resistant, but the educator needs to expect the resistance and actively involve the learner in the process of problem solving. The educator can then use the resistance to attempt to explore the reasons with more questions. Express empathy is very important because the questions may open up areas of the learner's life that they are not familiar with. This is again why active listening is so very important. Avoiding argumentation. It's important for when values and beliefs may differ from the educator. The educator is to stay unbiased, and when the urge to argue with the learner arises, it is important to adjust the questions to differ from the argument. Developing discrepancy. is what makes the conversations continue because it makes the learner think. When questions are used to contradict something the learner said prior, or actions they are performing, it helps the learner think deeper and then understand the topic better. S. Supporting self-efficiency is important towards the end of the conversation to ensure that the further learning is conducted. When the learner feels that they are a part of the education process, and they feel like they understand something well enough to teach it to someone else, they are often encouraged and inspired to continue learning. This teaching method fits into two of the domains, cognitive and affective. The cognitive domain is pretty obvious in that the questions are used to help the learner deepen their mental knowledge of their own values and beliefs. An example of this domain is working with a patient who strongly values physical ability and who has undergone a leg amputation. The nurse asks the question, "Does the value of human existence depend on the use of two legs?" This makes the patient deepen his understanding of his personal values and adapt them to his current situation. The affective domain is seen mainly in the use of motivational interviewing. The goal of the questions are to create behavioral changes, such as changing an attitude towards the situation. An awesome example I found was a story of a family who was experiencing problems that they thought were caused by one child who had a physical condition that required most of the mother's attention. This allowed for less time with her other children and her husband. The therapist asked the identified patient this question in the presence of the entire family. If you could give your condition to anyone else in the family, who would you give it to? After looking at each member of his family, the child responded, "I would keep it myself, because I think I am the best one to handle it." This attitude changed the family dynamic. The child was no longer seen as a burden to others, but as a hero. Benefits of Socratic questioning teaching method are the way you're able to correlate new concepts into known concepts. The educator is able to use the questions to find the base knowledge of the learner and then build on that knowledge with a new topic. The questions also promote further discussion and also support personal and value beliefs. The teaching method really encourages conversation between the learner and the educator instead of just the educator talking over the learner. And it helps build such a strong base of knowledge for any concept. The limitations to this teaching method are that some patients may not respond to the questions, or they may not be ready for the conversation. The level of knowledge that a learner has may not be able to be built upon. This can be the case with a patient with a mental disability. Also, depending on the situation at hand, the learner may not be ready for a deep conversation and just needs the basic information. The answers to the detailed questions is often unknown, so it is important for the educator to be ready for any answer. The educator needs to be ready to keep the conversation from becoming sidetracked and to continue guiding the conversation in a helpful direction. Lastly, in order to start the questions, a base level of knowledge regarding a topic is needed, so some one-to-one education may be needed first. This shows that this method can be time-consuming, and an inpatient nurse may not have enough time to complete the education with this method correctly. Healthcare examples include, specifically with patients and family education, it can be used in inpatient and outpatient facilities for known diseases. Questions regarding the care they are providing themselves and what changes they may have to make depending on their health concerns and the changes. There can also be deepening knowledge of brand new diagnosis after basic education is given. This teaching method can also be very good for the decision-making process relating to the treatment plan. It can help the patient work through all of the options and come to the conclusion that best suits them. This teaching method can also be used for educating medical students and peers. This form of teaching is seen often in the simulation labs that are utilized in nursing schools. The debriefing that occurs after a simulation has the educator asking the students pointed questions about the simulation and the concepts included. For peers, we are asked questions about in Socratic questioning form, yearly, quarterly, monthly, and so on, about various topics, such as patient safety, clinical skills, specifically with the yearly competencies, and proper equipment usage, such as wet time for sanitation wipes. In conclusion, the main things to remember about this teaching method is that it is built upon the use of pointed questions that deepen the learner's knowledge. The educator guides the conversation instead of directing it. The learner does the majority of the talking, which requires the educator to utilize and understand active listening. All of the questions are to continue conversation. There are no yes or no answer questions unless they're followed up with questions to continue conversation. Motivational interviewing is a form of Socratic questioning. And lastly, remember who your learner is and if this teaching method is appropriate for them. This teaching method can be hard for learners with mental disabilities and if they are not physically or emotionally ready for the pointed questions. Thank you everyone for watching, and I hope I was able to shed a little light on the topic of Socratic questioning. If you have any questions regarding this teaching method, please don't hesitate to ask.